Thank you very much, Ben, for that excellent talk. I was sitting next to Dr. Meyer, who said that his back hurt just from watching some of those cases. In a couple talks, I'll actually offer how minimally invasive spine surgery can potentially assist with some of the more complex deformities. But for now, I'd like to introduce Dr. Gordon Deen, the elder statesman of spine surgery at the Mayo Clinic, Florida. He'll be talking about management of spondylolisthesis.
Thank you, Selby. And I will say Selby had a comments earlier in the program about patients over 50, and I was a little bit offended by that, but that's okay. My topic is spondylolisthesis. Here are my disclosures. Here's our new neurosurgery clinic building, the Mangurian building on the Mayo Clinic campus, very beautiful glass building. And this is also really relevant to this talk because this building is somewhat remote from the rest of the campus, and I found that if a patient can walk from the main campus to our building, they really don't need a spine operation. So it's a good sort of a stress test. Spondylolisthesis refers to a displacement of one vertebra relative to another. Olisthesis denotes displacement in any direction. You can have anterolisthesis, which is forward displacement, retrorolisthesis, which is posterior displacement, and lateralisthesis, which is displacement to the side. The causes are listed here. Degenerative is the one I see most commonly in my practice. Isthmic we see not infrequently, as well as post-surgical and iatrogenic cases, as well as those associated with trauma, pathologic conditions, either infection or malignancy, and some congenital processes as well. This is a typical degenerative case with a spondy stenosis here and spondy at 4-5, very typical case we see in our practice. Here's another degenerative case here. Look at these facet joints here that, although there was no slip there, obviously the patient was really starting to wear out those facet joints at 4-5. Isthmic spondy, here's a diagram of that. Here's the pars right here. If there's a break through the pars, it's a spondylolysis. You may not have a spondylolisthesis if that disc is totally healthy, but over time the disc starts to fail and you get usually an anterior translation or spondylolisthesis. The severity is from grade 1 up to grade 5. The typical ones that I see are the grade 1, 25% or less, or grade 2, 25 to 50%. Grade 3 is 50 to 75%, grade 4, 75 to 100, and grade 5 or spondyloptosis is more than 100%.